So my video project is on otitis media, or as it is more commonly known, an ear infection. The reason why I wanted to make my video project on otitis media is I have a niece who suffers from very chronic ear infections, and I've always been curious about the process and what causes them. So let's start off with the basics first. What is otitis media? So ot comes from the Greek meaning ear, itis means inflammation, and media simply means middle, so it literally translates out to inflammation of the middle ear. So as we learned this semester during anatomy, you have the outer ear, then you have the ear canal, and then we come to the tympanic membrane. Behind the tympanic membrane we have our three ossicles, our malleus incus stapes, and those are connected to the inner ear, to the structures of the cochlea. And the eustachian tube is there. So basically what happens in otitis media is the eustachian tube becomes blocked at some point. Now this happens much more frequently in children, and let's take a second to see why. So in children, the eustachian tube is actually more horizontal than it is vertical. It is also shorter in length, and it is also more narrow than an adult. So essentially the eustachian tube is used as a drain for kind of this infection and pus that can build up. But if you think about a drain, drains work with gravity, so if our tubes are less vertical and more horizontal, it's harder for that liquid to move out. And also if they're more narrow, it's harder to push this infectious liquid through. So in children, the eustachian tube is very easily blocked. Once the eustachian tube is blocked, that leads to a backup of this fluid, which will eventually, in most cases, start to make contact with the tympanic membrane. Now, growing up, we would all wonder why a doctor would stick that weird looking instrument in our ear when we would come in and say we felt sick or we had a sore throat or for whatever reason. Now this instrument is called an otoscope, and the doctor all that time was actually just using this to view our tympanic membrane. So tympanic membranes will look different when there is an acute pathology of otitis media present. That infection will push on that membrane, and kind of like a water bottle that's squeezed really tight at the bottom, that membrane, almost like the plastic, starts to bulge out. Also due to the inflammation, you have increased blood flow, so increased red blood cell presence, which gives off this red color. And of course, there's pain, as any child who's ever suffered through this will tell you. So, what can happen to the tympanic membrane? Well, it can burst or rip. It becomes perforated. That's really the number one way that otitis media resolves itself. This infection has to go somewhere. 9 times out of 10, it's going straight through that tympanic membrane, and children will experience discharge that comes out of their ear. When this perforation does not happen normally, it can lead to very serious consequences because that infection can stay there in the middle ear and eventually start to make its way to the brain, and can, in very rare cases, lead to life-threatening situations. So we know that a tympanic membrane can rupture, but what are some things that can be done sort of proactively before this happens to treat otitis media? So the first initial step in treating any kind of infection is to be put on an antibiotic. These antibiotics are going to help destroy the bacteria in the ear that's creating this infection, and obviously the pus is created from white blood cells, macrophages, things coming in to battle these. So the most common medicine that children are started out on would be a round of amoxicillin administered orally. Nasal decongestants are also used. Common nasal sprays that are used for allergies. What these do, obviously, our eustachian tubes are attached to our nasopharynx, which we know is in the back. It's kind of like our nasal throat. cavity. So when we inhale these things, these chemicals go up and hopefully go to that tissue in the eustachian tube and help reduce that swelling. And obviously a reduction in swelling is going to allow for better flow. And when there's better flow, there can be better resolution of the pus. And the last treatment that is most common is actually called a myringotomy. Myringotomies are where the physician will actually incise the tympanic membrane themselves. This can be done in a single session where just a slit is placed. That infection is able to drain out the ear, and then the tympanic membrane will heal itself. Also, during a myringotomy, the physician can place tubes in the tympanic membrane, which allow for a temporarily permanently open hole. I know that sounds like an oxymoron, but it allows a means of diffusion for this infection for children who are more prone to have these ear infections. Hopefully after all of those treatments and courses of action, we are led to healthy, normal baby ears, right? Yeah, say healthy.
Healthy.
Normal?
No.
Good job. Mwah. And that concludes my project for anatomy. Thank you.